Now, there's also one other major concern for females that have asymptomatic gonorrhea infections, or at least asymptomatic during initial infection. Gonorrhea can ascend further into the female reproductive tract, meaning it can move further up into, say, like the body of the uterus, into the uterine tubes, which are also known as the fallopian tubes. It can also affect the ovary and even the parietal peritoneum, which is this thin tissue membrane lining the pelvis. And when this ascending infection occurs, it is known as pelvic inflammatory disease, or PID. About 10 to 20% of untreated gonorrhea cases develop into PID. And again, this is often because the initial infection was asymptomatic. But when symptoms of PID begin, this can include lower abdominal and pelvic pain, abnormal bleeding between periods, and dyspareunia, which is a fancy pants way of saying pain during intercourse. Now, PID is treatable, although there continues to be increasing concerns about the treatability of gonorrhea infections that we'll talk about soon. But one of the biggest concerns about PID that we'll discuss now is that it can cause scarring within the uterine tubes, which can lead to infertility or ectopic pregnancy. And an ectopic pregnancy is when a fertilized egg implants outside of the uterus, typically in the uterine tube, which can be life-threatening and requires immediate treatment.